Hi, I am Dr. Naveen Gupta, a member of Neoscan Healthcare Limited. So today I am glad to present a simulator which gives a near real-time experience of performing point-of-care sonography in neonates. This simulator, which has been named Simbu, has been developed by Neoscan Healthcare Limited in collaboration with Ideas Unlimited. It contains lung, heart, brain and lines module. So let me demonstrate you how it works. So let us start with the heart module. So in the simulator, we have made many points and the point corresponds to the specific area where we normally put the probe on the baby. Like point 2 has been has been made as an apex. So let's start. So this is our lovely Simbu, and on this Simbu we have a probe which is connected to the Simbu, and we have a cable which goes from the Simbu to the tablet. And there are multiple points, and the point corresponds to the areas where we perform echocardiography or sonography in the newborn. So how to proceed? So while switching on the tablet, once we switch on the tablet, we can see an icon of the ultrasound probe with the cable attached. When we press on it, so it opens up the window. I put my probe on the apex, which is number 2, and my pointer is towards the 3 o'clock position, and you can see that the pointer on the screen is pointing on the left, and I see a lovely apical 4-chamber view. Now, on the right hand side of the tablet, there are 3 points: normal, color and Doppler. So normal means the 2D view, color means we will press on it and the color will come, and the Doppler means the Doppler will come. Now, I come back to the normal 2D view. Now, if I have to go from the 4-chamber to 5-chamber view, I have to tilt my probe anteriorly. So now I am doing the anterior movement, and while performing this anterior movement, if you see on the screen, the 5-chamber view or the aorta has opened up, right? So this is how, like in the baby we do the movement, the similar kind of movement in the simulator opens up the 5-chamber view. If I have to see the labeling for learning, I click on the normal 2D again and I see all the labeling. I go to the color mode and I can see the blue color which is flowing from the LV, which is the blood flowing from the LV into the aorta. If I press the color mode again, I see the label. Now come back to the color mode. I want to see how much is the left ventricular output. I press on the Doppler, and I could see that in the Doppler, I could see a very nice the aortic stroke volume and the velocity time integral. I press on the Doppler again, and I will see the calculations. And with the more anterior tilt, I can see that there is a pulmonary artery which has opened up, which is going from the RV. So if I have to see the labeling, I can see the label by pressing it. I see the color mode, and then in the color, it's a blue color which is going away from the probe. So this is how this simulator gives us a real-time experience. If I have to go for the Doppler, I do the Doppler, and then I calculate the VTI, and I get all the readings. Whenever we are in doubt, suppose the learner wants to anticipate that, okay, what is this view? You can go into the more info, and when we click on the more info button, we can see that the presentation runs, and we will get to know about the normal views about the heart. We can see that on the top, there is an area. When I am performing the functional echocardiography, the area comes as the heart. And if I will be doing the lung, the area will come as the lung. And if I will be doing the brain, the area comes as the brain. Then there is a condition. Right now I am performing on the normal view, so it's a normal heart. Suppose I want to look in the pathophysiology of PPHN, so I will click on the PPHN thing, and I will see that, okay, in PPHN, as the septum on the right side is more dilated, septum is deviated towards the right side. I put the color mode, and I can see that there is this is a mitral regurgitation, and this is a tricuspid regurgitation of the pulmonary hypertension which is going on. And I put my Doppler, and in my continuous wave Doppler, I will see that I am seeing the tricuspid regurgitation check. So these conditions are developed for this thing. In all the views, we will see the conditions of the baby. So for the PDA, so if I am dealing with the PDA, I will put my condition from normal to the PDA, and then I see that a beautiful 3 vessels arising from the pulmonary artery. The first one is the right pulmonary artery, and if I'm in confusion, I will do the labeling. The second one is the left, and third one is the duct. I put the color, and I can see a beautiful, you can see that beautiful left to right flow across the ductus. So this is how basically we can do all the, for functional echocardiography at various points. We put the probe and we simulate the conditions which we see in the babies, and we can simulate the near time experience as we perform in the baby. Point number one is the parasternal long axis view and the parasternal short axis view. For parasternal long axis view, as you are seeing that my pointer is pointed towards the right shoulder, and I can see the beautiful parasternal long axis view. I do the tilt, I do the inferior lateral tilt, and you can see that the tricuspid valve has opened up. I come back, see the movement of my hand, I come back to the original position, and then if I do the superior medial tilt, then you can see that the pulmonary artery will open up. And if I put the color across the pulmonary artery, you can see the beautiful blue color, and you can do the Doppler here so that you can estimate the right ventricle. And one more thing, if you will be noticing on the right hand side of the screen, there is the probe, how the probe is cutting the heart for learning, for the learners to understand the same thing appearing. Like here, it is cutting toward the pulmonary artery, so it is going like that. If I come to the parasternal long axis view, normally you see that how this is cutting. And if I come to the inferior one for the tricuspid valve, how this is coming. So this is how things have been demonstrated very beautifully in these symbols. So in the lung module, we have developed 2 points, number 11 and number 12. As we put our probe on those points, we can see that we are right now seeing the A lines in the lung. I put a condition, let's say I put a condition of pleural effusion. I could see that there is a fluid, this is rib, and then there is a fluid. This black hypoechoic shadow or the black shadow is all the fluid, and below the fluid I can see the air bronchogram. I keep on changing the condition, like suppose I have to look for RDS and score 1, I can see that there are multiple B lines there, and there are 3 or more B lines in the one intercostal space. I press it more, and if I have to go for score 2 and score 3, I can see that this is how this works. If I want to see for the pneumonia, so I keep on changing the conditions and things will keep on coming. Let's say M mode I haven't touched about. So if I want to see in a normal lung how this lung is, I could press on the M mode, and you can see that there is a beautiful seashore sign which is coming. I press it again, and then the label comes, and the labels has been demonstrated here. When we go to the brain, we put our probe in the way we put in the normal baby, like the pointer, which is this pointer is pointing in the right direction, and we are doing the coronal section. We can see that as I am moving my probe backwards, the views are coming as we traverse through the coronal section in the brain. So now you can see a beautiful choroid plexus view. I go more posteriorly, and I can see the occiput level. If I want to assess my anterior cerebral artery Doppler, I will put the color mode, and I can assess the Doppler by pressing the Doppler button. I press it again and I can see the label. I come back, the midline view, I go either towards the right or left. Right now I am going towards the right, and you can see that towards the right side, I can see the choroid plexus on the right side, and then I go further, and on going further, I will see the Sylvian fissure. Let's try changing the condition. If I change my condition from normal to, let's say, the intraventricular hemorrhage. So similarly, we can go to the brain. In the coronal view, right now my pointer is pointing in the right direction, and we can see that we are seeing the frontal view. And as I am tilting my probe and my tail is coming in the front and my footprint is going back, we can see that I'm seeing the corpus callosum and the anterior horn of the lateral ventricle going backwards we can see both the choroid plexus, and going more backwards, we can see the occipital lobe. Let's say I change the condition from normal to cystic PVL. How does it happen? So as you can see that when I have changed the condition from normal to cystic PVL, you can see that multiple cysts are present. Right now I am in the occipital area. I come forward, and this is my choroid plexus area. I move my probe further, and you can see that the cysts are present here, and the ventricles have comparatively enlarged, and in the frontal area also there are extensive cysts which are present. And I do my sagittal motion, and let's see that my condition is same. Condition is cystic PVL only, and you can see that in my sagittal cut, I can see that through the parietal and the temporal area, multiple cysts are present, and they are present by both the sides, right and left. So similarly, in the brain model, we have done all these things. So if someone has to assess that how are the jugular veins, and for learning purpose, we have made a point in the neck similar to to assess the jugular vein, where we can put our probe either in this longitudinal direction, or we can put our probe in the short axis. We can see that there are two circles which you can see. One circle is compressing, and the other round circle, which is inferior or which is medial, is not compressing. The circle which is compressing, that is the vein. This is how we can identify the jugular vein. And if we put it in the longitudinal section, you can see that there are two vessels which are going. One which is collapsible is the vein, and one which is not collapsible is the artery. So normally in newborn, we go with the transverse view, and in the transverse view, we normally, when we see the the collapsible circle, we identify that as the vein. The color doesn't make much sense here. The right doesn't denote the vein, and left doesn't, the blue doesn't denote, the red does not denote the vein, and blue does not denote the artery, or the vice versa. So just go in the normal 2D view, and collapsibility can tell us that. And the number 9 point has been developed to estimate the bladder. Many a time, as a fellows in the NICU or as a consultant, we don't know whether the bladder is full or empty. We have to catheterize the child. So you put the probe on this point. So the Neoscan Healthcare Limited, as a part of that, we have developed few phantom models also. One is the phantom model for line, and in which we can do the ultrasound guided tracking of the needle tip. As you can see that, so I bring my line in the focus, and you can see that this is the line, and this is simulating that if I have to put the jugular line. So along the long axis, we can see this tube, and if I'm putting my needle, you can see that how well we can track the needle. So in the ultrasound, we can see that how well we can track. Now this is the point when we have punctured. We hold our hand steady, and I suck a little bit of fluid, or if I push, you can see that the air bubbles, and they generate the contrast. When it comes to the brain phantom does give the learner a good experience of how the probe should be held and the probe should be tilted. Like it's a coronal view, and in the coronal view, if the person has holding the probe, you can see that we can see the two anterior horns of the lateral ventricle. On tilting the probe posteriorly, as you can see my hand movement, we can see that the choroid plexus they are present, and then we see the posterior horns, and we can see a very nice intrahemispheric fissure. And on the sagittal plane, you can see that this is how the ventricle looks like. So, or whether it's on the left side or it's on the right side.